Blood reservoirs. I touched on this a little bit when I talked about the spleen in the dog the other day. So venoconstriction and capacitance, all right? Another way to look at that concept is that these are blood reservoirs. In other words, places where blood exists in the body that can, where the volume can be changed to meet the body's needs, all right? So all of these can increase or decrease their volume according to the cardiovascular status of the patient. In other words, if they're dry, these volumes get smaller. In other words, the blood is pushed into the circulation. In periods of exercise, these volumes get smaller as blood is pushed into the circulation. When we sleep at night, these volumes get larger, right? Because we don't have as big of a need for lots of blood in capillary beds. All right, so the big blood reservoirs for this human, 100 milliliters spleen, 200, 300 liver, 300 large abdominal veins, 2 to 300 skin, okay? And then heart can reduce its size a bit. Remember, that's contractility, okay? So when sympathetic stimulation increases, we get smaller ESV. And then the lungs, when the pulmonary pressures are decreased, like deep in inhalation, we can increase our blood volume there. So these are all places where the amount of blood can either increase, taking it effectively out of the circulation, or decrease, putting it into the circulation to change venous return, right? Now, all of these things, I would say the how quickly this changes is in the minutes range. Like this can't change in seconds. Veins aren't that snappy, okay? But within a minute or two, you can have fairly good mobilization out of your blood reservoir. Certainly within 5-10 minutes you can. I talked about the dog has a contractile spleen. We don't, but our liver sinuses do. So like we do get that little blood transfusion that the dogs get, but we get it from our liver instead of the spleen. Now, one of the neat things about the splenic part is the spleen's anatomy is a little like a sponge. And because of that, it has a tendency to sequester red cells and let plasma go through. So it means compared to the blood in the rest of the body, the blood in the spleen has a higher hematocrit. It has more blood cells per unit volume than blood in other places does. It's one of the reasons why when the spleen contracts or when the spleen mobilizes its blood resources, it makes a big difference for the organism because we don't just get volume, we get oxygen carrying capacity, right? Remember, red cells are how oxygen moves around. No red cells, no oxygen carrying capacity. Plasma, we need plasma, right? That's the water fluid component. But plasma doesn't carry any oxygen for us, right? So it supports our blood pressure, but it doesn't support delivering oxygen to the tissues that need it.